Hi, Rob. Thank you so much for joining us today.
Thank you for having me on. I appreciated having you on my show. I look forward to talking to you.
Yes, well, we're talking about something very important, and I think really that's finally getting more attention. More, we have a lot of people that are suffering with breast implant illness, and no one was really talking about it, understanding. I think a lot of these symptoms people just brushed off as other things. So, can we just kind of let's start with the basics. Let's dive into what breast implant illness really is and what you can kind of expect to see if this is something that's affecting you.
Yeah, I don't envy any, provider of any level trying to understand this problem with a patient sitting across from them describing these symptoms. So I consider breast implant illness a chronic inflammatory process of which an implant, in this case, a breast implant, is involved. It could be a hip, knee, dental, piece of hardware for whatever reason, because your body reacts to whatever's foreign, creates a collagen response, which is your scar tissue around the device, and then over time, many of us, due to our genetics, so how we detoxify things in conjunction with what we get exposed to, and we can go into that later, the foods we eat, the air we breathe, the fluids we take in, the things we apply to our skin, in combination with our gut health, food sensitivities, hormone balance, all of that just can either, keep you in a low inflammatory state, or you can build up levels of chronic inflammation over time. So it's a long-winded answer to tell you that all the things that are associated with chronic inflammation of any body system. So if it's we'll just say your brain, you can have brain fog, which is to me more like short-term memory loss. You can have headache, even migraine. You can have dry eyes, kind of sinusy type symptoms where you have stuffiness. You may feel like you have sinus pressure all the time. You can have difficulty swallowing. Things may get caught. You may have a cough. You're going to be short of breath, have chest pain, palpitations, kind of that kind of racing feeling in your arms and legs. You can really have a host of things. I've heard of vibrations, so kind of just a sensation of vibrating all over. Um, Shocky pain, like neuropathic pain, pins and needles, heat, and or cold, and of course joint and muscle pain. And then as you get into the abdomen, which is literally Pandora's box in this scenario, you can have constipation, diarrhea, swelling, bloating, pain, pressure, um, just you name it. I've heard about it.
Mhm.
I haven't even brought up things that go on with the reproductive tract, the urinary tract, chronic UTIs, the skin, eczema, rashes, cystic acne. I mean, Meg, it is a long,
Yes.
long list. And just imagine being the provider on the other side of that, trying to figure out that problem. And they're like, I don't know. I don't know what that is.
And that what's interesting is so many of the things you're saying. So, as a functional practitioner, I'm hearing those symptoms. Some of them can overlap with like mold illness when you're saying like the tremors or the ice pick pains or things like that can be symptoms of other things. So, you're really trying to peel back like, do you sometimes see like, can you make progress with other things, or you're not making much progress? You probably have it's probably actually the implant that's behind this.
Yeah, I think a lot of folks, once they get to sit in front of me, they've already decided they're going to have an explant. So
Okay.
the larger portion of the people, which is what, we can do, currently to help them is what you're asking. Like, how can we diminish some of these symptoms? Can we make some inroads to help them lower their inflammation? So we have started, you know, for our patients who aren't ready for surgery, don't want to have surgery, have implants in place, but have high amounts of inflammation. How can we lower it now?
Hmm.
And so my book Sharp is really about this process and how I think about it. But the things we can do consciously to take action to lower inflammation are, simple things. Being very strict about what you put in your body as it relates to food and fluid. And, everybody kind of was like, oh, what's he talking about? Everybody's heard of filtered water,
Mhm, yes. We talk about filtered water a lot. Yes.
but
Could be a whole
don't drink
separate
it out of
conversation,
plastic,
right? Yeah.
right? The problem there
Mhm.
is like if you drink out of plastic and you're a woman
Yeah, that's
and you
true.
get phthalates, or a
Hmm.
man and you get phthalates in your system, that affects your sex hormones. So
Hmm.
I think, you have to take the next step in the process to help yourself. And when you're trying to eat, I think this is the hardest thing, to be honest, because magically within the last decade, everything became organic, which is complete crap,
Yeah. Yes.
right? So
Mm-mm.
now my wife and I go on Saturday to a farmer's market near us, and we get the majority of what we eat from a farmer's market. And
Hmm.
so whether it's wild caught fish, there's a nice lady who has wild caught fish from Alaska.
Okay.
And there's, different ranches around Texas that show up to the farmer's market and bring different cuts of meat. And then uh the vegetables, those could be all over the place, but there's a particular uh, farm that has aeroponics, not hydroponics, and the vegetables they almost don't look real. The colors are so amazing and vibrant. I was like, it takes a lot to kind of get me to
Hmm.
respond to things,
Yes.
honestly. And I looked at it, and I was like, that is an amazing it doesn't even look real. It's like it was
Mhm.
some painted version of a vegetable. And so we buy things there. Uh, I guess that would be, ways to really help yourself. So if you are in an area that has a farmer's market, start going there and, seeing what's available that you could get. Is probably the most expensive thing you'll do for your, family and yourself outside of, paying for where you live, things of that nature. Good foods,
Okay.
very
Hmm. It
expensive.
is.
But once you change the quality of the food and fluid in your diet, you will notice differences because things like gluten and or products that, for me, dairy is not good. I don't do well with dairy, not because dairy is bad, but the way the dairy is processed in our country is bad. So
Hmm.
there's a lot of things I'm sure you spend a lot of time educating your patients on. So for my patients to engage with us, you know, whether you're remote or in person, whether you're having surgery or just thinking about surgery or want to lower inflammation, it's like cut out gluten, cut out dairy, eliminate anything processed. So if people don't understand what processed foods are, anything in a bag or anything in a box is really not food.
Hmm. Shop the
So,
perimeter.
right. So if you
Yes.
can't hold it in your hand, if it has a label on the back of it, it's probably not food.
Hmm.
Food doesn't need a label. So, that's how we start. And then we try to convince people, obviously, to use uh, good oils like extra virgin olive oil or avocado oil. And I mean, there's just so many things you have to do
Hmm.
again to get on the right track. And of course, we're the pill shot drug society. So people are asking me what they can take, and they may be already taking a host of supplements. And then I will say, here, I've done thousands of these cases. I know the genetics of this problem. I know the specific nutrients for this problem. And if you have a lot of people with absorption issues like I have in my practice where they eat something, they may get pain. People tell me they drink water and they have trouble.
Yeah.
And so that creates a big problem for us as providers. So what are we going to do to help them with proper nutrient supplementations? Because if you check them all, I would imagine the majority of them have a micronutrient deficiency of something.
Hmm.
And it's not something like little. It would be
Yes.
something big like vitamin D or maybe their B vitamin level, if you could test it properly because they don't methylate properly is substantially lower than it should be. So their energy levels are decreased. So all these things, kind of basic things, I've converted most of what I do to support and lower inflammation problems into liquid or liposomal formulations. So you can just take a mouth spray or a drop and this, I think it makes it easier. People don't like to take a lot of pills many times. They struggle with swallowing them and they already don't feel well. So if you could just make it simpler for them with a spray or a liquid that you just have to have a sip of, then that would build better compliance. They would feel better about using it. You would then as a provider think they're going to
Do
do
it. Yeah,
this
that's
to
half
help
the battle.
themselves because it's easier for them. So those are my like basic things to start with. So proper supplementation, proper diet through food and fluid. I'm a big believer in improving your air quality. So in my clinic, we have all these separate air filters. So people are really like, why is it so noisy in here? Well, in every room, there's typically another air filter. So the quality of the air, like nobody has allergies in my office
Mhm.
because the air is getting filtered so much. It's very hard to come in here and have a problem. We currently use Jasper air filters, and they're aesthetically pleasing. I know women want to have a nice air filter in the home so it doesn't stand out. My wife is like this. So those are they look like a modern piece of furniture. They can sit in your home. And then I think, Meg, the thing that I prioritize the most, I want to emphasize the most in terms of where you are in a inflammation lowering journey is you have to sleep. If you
Yeah.
don't sleep,
Hmm.
if you can't get a 7 to 9 hour window of uninterrupted sleep and get into deep sleep, all the things that your body has to do to help reset, if you will, or heal itself or lower inflammation or get your hormones about, it can't happen. So
Hmm.
it doesn't matter how good of a provider you or I are. If those basic things don't happen, which are all behavioral for the most part, it makes the process that much more difficult.
Okay, so what I hear you, absolutely agree with that. I know I have so many people that come in and say, all these things, and then we ask, well, do you sleep? I'm so exhausted. Well, are you sleeping? And I'd be like, we need to go back to those basics. But what I'm hearing you saying is that if you decrease your inflammation, then if you're having the symptoms of the breast, I guess my question here is, can lowering your overall inflammation load help someone who has breast implant illness? Will it
Oh yeah.
make or do you have to do the explants?
I think, we've seen examples where people can lower their inflammation, but if you're saying, can they get it completely resolved?
Mhm.
That's a larger question where we look at toxicity testing very intensely because I don't know where you grew up. I don't know where you lived. I don't know the quality of the food or fluid or all the things that over time would affect you. So when we look at folks, we'll find all sorts of interesting things. Mycotoxins from mold, heavy metals from maybe groundwater. But the chemicals, the environmental things that people have in their systems are pretty amazing. Things like atrazine and parabens and phthalates and glyphosates and uh, mercaptopurines and NACE from secondhand smoke. So if you grew up in a household where everybody smoked,
Mhm.
you're going to have NACE in your system. And that's just from secondhand smoke. So there's like all these things that maybe we can help get everything lower for you, but your genetics and how your liver detoxifies things basically through glutathionization. Like if it can't handle those things, if you're the person who's sensitive to perfumes and odors and all these things, that pathway is already probably pretty limited for you. So even if we can get it completely, uh, I'm sorry, even if we can get it lowered, it may not completely resolve for you. But you can definitely make headway on it. I've seen this happen, because I'll have patients who need to be scheduled out, say 6 months. It's a
Mhm.
teacher. They only have the summer off. They've learned of this, 6 months prior, and they want to start doing things to help lower their inflammation. So we would, just like we spoke about, put them on the correct, supplementation based on what we've seen and then adjust their diets. Because many people don't understand how big of a role the nutrients that come in through the foods play and how they feel. And once they start adjusting those things, they'll notice that get better. Like if you don't know how big of a role gluten plays in your system, non-celiac gluten sensitivity is a big problem, period.
Mhm. Yes. Okay. That, and could we dive in a little bit to the genetics? Because I know you were talking about detoxification, how you look at specific genetics. What are some things people would be thinking to look for? I know they may not know, understand, but just to have an idea of what you're looking for.
Yeah, we've used a number of vendors over time to look at this, and currently we use Envision Labs. And the reason being is they look at drug metabolism, so how your liver helps you metabolize drugs. But to your point, like what, and we'll speak globally about immunity. If you can't detoxify um, a mold toxin, or if you have trouble detoxifying phthalates or a glyphosate, which is glyphosates are what are put on crops, and that gets on our food, and then we ingest it, which obviously, everything that goes in gets absorbed through your GI tract. It's got to get detoxified if it's recognized as a toxin. And that happens based predominantly, we'll just say the liver. And in that pathway where glutathionization is important. Everybody's heard of glutathione. It's an antioxidant. It basically will help bind these things up and get them out of your system. So if you have, say, a limited enzymatic ability to run that pathway, maybe not enough copies of the gene or the activity is lower of the enzymatic pathway, as that builds up in your system, it'll overcome your ability to detoxify whatever that substance is. And then you'll become more symptomatic. And I'm sure we'll just use an example of vitamin D. So vitamin D is always like, I get people coming in, my vitamin D level is always low. Well, and they'll say I get enough sun, I eat enough, of the proper things in my diet to get vitamin D. But if you don't convert, activate, absorb, it doesn't really matter that you're doing all that. So we use a lot of vitamin D3K2, and that's just a function of genetics. So even if you got enough sunlight and had the proper diet, if you have those problems enzymatically, you can't convert it and or absorb. It's not going to happen in the same way in someone who could do those things genetically. And then I think everybody at this point understands and has heard of the MTHFR gene almost. I mean, people come into me and tell me they have it.
I have MTHFR.
Yeah, like it's okay. It's not a badge of courage. About
Yeah.
40% of the population has this. I do.
I
And
do too.
so methylation is a chemical group that gets added on. It's part of numerous cellular processes. And if you don't methylate well, you then need methylated B complex, and that's what we use. And then you can see now, as you start to build and take tiny steps towards, the greater goal, which is lowering inflammation by doing these fundamental, you know, they're not even hacks. They're just simple things to do. And
Hmm.
of course, everybody has heard of vitamin C. Vitamin C is an antioxidant. Now, it's incredibly important that in your pathway that handles, we'll just say, high levels of oxidants or things that are created by the cells, they're called they're products of oxidative stress. So oxygen species need to be detoxified, and we'll say that's what vitamin C does for you. So you want to get enough vitamin C in your diet. The thing that we've found is we just try to provide it in that liquid format, so it's much easier for the patients to absorb, and it doesn't have other preservatives or additives that could react to with them. Of note, and I used to do this, so I'll just speak about this. I don't do this anymore. I used to have those bars that were gluten free, and you have to be careful because everything in the bars, when you read the labels, there's a lot of things added to them to make them hold together or to provide a flavor so that it's, tastes better. It may have monk fruit in it or stevia. And if you don't know, a lot of people are sensitive to things like monk fruit and or stevia. So once again, I was guilty of this where I was not doing a good job with eating as much because I was on the run, going to the operating rooms or in a very, very busy clinic. And I wouldn't do a good job with eating whole fruits, whole foods. I would eat, like I don't even know the last time I actually had a bar at this point. I just don't eat them
Yeah.
anymore.
I try to work them out of people's diet too because they're easy, but it's really, really hard. I don't know that I haven't, you're saying you haven't found a bar that's really good for you. I mean, they label it like they are, but if we can avoid that, I agree with you. Let's
I
get
think
something
it's
that's
funny
natural.
that you bring it up because at the farmer's market, there's a little stand that pops up and they have these natural looking concoctions. What you would buy in a store looks like a bar, it's got a pretty package. And somebody who's making these things at home, it looks entirely different when you pick it up at the farmer's market and you're like, hmm. And my daughter was like, that looks gross, Dad.
Yeah.
But that's the thing, right?
Yeah,
It's
it's
not got a
natural.
pretty wrapper on it. It's not got any marketing behind it. It's just real food that's been
Mhm.
put together. And we've gotten into this. It has to be like a certain taste or a certain appearance has to be attached to it in order for us to then engage with it. And that's really not reality. That's
Mhm.
just marketing.
Yes, absolutely. So, okay, so we're bringing down inflammation. And now you have a specific process if we get to the explant. If someone's like, okay, I really do need to get these implants out.
Yeah.
Um, I know you have the lymph massage and you have like a whole system that you do that's kind of different than other practitioners.
Yeah, if you've gone through the process and we'll say all the things you're doing, they're helping lower it, you're feeling better. Um, People have to arrive at a very specific emotional point where they just either don't want to have a foreign substance in their body anymore. And a lot of people lead or want to lead a more non-toxic lifestyle now. That's obviously their choice. I tell everybody, I don't decide anybody's explant. They've come to me and decided that. No one sits in front of me to get my, seal of approval. I don't do that. I explain risks and benefits of a procedure and provide guidance based on the things we've published to look at bacterial contamination. We can talk about that later, but from a process standpoint, if somebody's arrived at that process and done the prep and decided, all right, I'm gonna take this next step, the things that we do are meant number one to always diminish any post-operative problems. So nausea, swelling, discomfort from surgical site. And then how do we go about doing that? So I think if you just think about how people heal, it goes back to what we already talked about. Like if you don't have the proper diet, there's no chance you heal in an efficient way. So we use a lot more clean protein in our program, and I do it to be like I don't care what diet you're on. It's not my my issue. So we have a pea protein in our program that we leverage a lot because it doesn't have those additives. It's very simple and nobody can complain about its sourcing. So
Mhm.
it works. And we're trying to get a really specific amount of protein and then gauge where you are. So we want to ramp you up to about a gram per pound of body weight, which sounds like a lot. If you're just a 100-pound person, that's a lot of protein for you, probably more than you've ever had in your entire life. Your whole system is going to change, and you'll have to take some additional digestive enzymes to help with that. But that's the way you start. That helps switch somebody after surgery into healing quicker. And
Mhm.
then to your point, what do we do? So we don't use drains when we take implants out, just like people don't use drains and tummy tucks anymore. We're trying to leverage the most efficient filtration system in the world, which is your lymphatic system, to help get all of the fluid out as quickly as possible. And I'll just pause and highlight something there. The most common thing done in the world is liposuction. So they put fluid in and they take fluid out.
Mhm.
That comes out with fat and fluid, of course, but they don't ever get all the fluid out, Meg. So if
Okay.
someone were to put a couple liters of fluid in you, they would not be able to get a couple liters back out.
Mhm.
So where does the fluid go?
Yeah, that's a
Nobody
good
puts it,
question.
nobody puts a drain tube in anybody getting lipo, or
Hmm.
for the most part, that really is not a standard practice. That
Yeah.
it's because you'll absorb the fluid and pee it out. So
Okay.
there are some specific things that you want to be careful with. Like if someone were to add local anesthesia like lidocaine, you have to be careful how much gets absorbed, how quickly it gets absorbed. But for the argument's sake, if I put 6 liters of fluid in somebody to take a couple liters out, where does the other 4 liters go?
Hmm.
That's the responsibility of the patient's lymphatic drainage system. So, to your point, the way we do it in the office to make it more efficient, we have these great devices from New Zealand called Flow Presso. You set them, they work on the arms, the legs, the abdominal area. And over a 45-minute window of treatment, it gently massages, increases the drainage through the lymphatic system. So people typically have to get up and go to the bathroom after that.
Mhm.
And so if you do that consistently and add that into your care plan after a treatment, that will help get the fluid out quicker. And for everybody listening, discomfort is really a direct result of how much swelling or how much is going on in the tissues. And when you remove the fluid faster, you have diminishing um, uh, discomfort. Really, it's more quickly, it's more efficient. And then we always in our clinic use hyperbaric oxygen, and oxygen helps everything heal more efficiently. Like all of us, if we don't get enough oxygen in 4 minutes, we're dead.
Mhm.
If we don't pee for a day, we die. So air, quality of air, improving, getting oxygenation to tissues, especially, Meg, many people come to me after they've already had multiple surgeries done.
Mhm.
So
Okay.
I'm already in a disadvantage, being the surgeon who's now got to do this next case. And I
Uh-huh.
let everybody know, I'm like, I don't make blood flow better by doing another surgery. We have all these strategies to help you heal, your diet, your supplementation, better oxygenation, lymphatic drainage, red light therapy. We do red light. Red light helps lower inflammation in areas of, either injury or surgery, and then it helps elevate your levels of the sex hormones to help initiate better healing cascade. So everything we do, I don't, none of it's, you know, without a purpose, a plan. And then, all the things we talked about, getting proper sleep and um, the right amount of and the quality of fluid and food and all those things make a difference to make you and help you recover faster. I just try to highlight, all right, there's genetic differences. Susie Smith is going to recover differently than you. She may get on Instagram and say she's magically better a day after surgery. Well,
Yeah.
okay. I tell my patients not to do that, even if they're like that, because it sets up an unrealistic expectation.
Hmm. You have to be able to heal your body. You have to be able to detoxify what was in your system. That can take time. That's a good point. I have another question that I wondered. Do you get breast implant illness right away, or is it something that someone can have implants for 10, 15 years and then start seeing the symptoms? Do you see it change over time for people, or is it usually like, okay, their body doesn't like having the implant in kind of from early on?
Yeah, that's a different type of question to answer. We published a paper that shows when we explant them, 29% have a bacterial contaminant that leads to. So when bacteria contaminate any type of implant, it can lead to a biofilm. A biofilm makes it harder for your body to eliminate it. The original biofilm was discovered on teeth. It's called plaque. And when you have that on a device, papers have been published about the interaction of the bacterial biofilm with the breast tissue. Specifically, there's a fatty acid in the breast tissue called oleic acid, and it can become oxidized and form a new molecule called oxylipin tenhome. This can create more fatigue. It can create joint pain. It can create dry eyes. So all these symptoms that we thought are immunologic now have a basis rooted in a scientific um, paper, but in the paper it shows these oxylipins help contribute to these symptoms. So in in my experience, I see that later. It's not that it can't happen soon, but I usually see it
Okay.
later. And it's more of a consequence over time. So for somebody to get a bacterial contaminate on an implant at the time of surgery, that's very low probability. It
Mhm.
can happen, but it's super low. The more common thing we see is over time through accumulation of environmental exposures and or ways to get bacteria in your system, maybe through a cut in your skin or urinary tract infection or a respiratory infection. Those types of things then will contribute to everybody getting this potential bacterial contaminant. And it's funny, I get asked all the time about, are there mold, uh, is mold found on implants? And so in our study of almost 700 consecutive samples, the answer is no. It's predominantly two types of bacteria, Staph epidermidis and Cutibacterium acnes, which are found in high concentrations on our skin.
Mhm.
And that's on a PCR test. I can't make it up. I can't, fabricate a result. Those are the results. And so when people send me something, they're like, oh, but, they're constantly talking about mold and implants. I'm like, I don't really care. First of all, like implants all have these silicone shell exteriors and they have metals and other chemicals in the shells. So, of the ones that are filled with silicone, obviously they can't have mold inside because they're pre-filled. So now
Mhm.
we're just talking about those filled with, at the time of surgery, sterile salt water. That's basically what they're filled with. The same thing, you would go to the IV drip place and get a IV infusion of vitamin C or whatever. And it's just very hard for me to understand how this is going off the chain and become such a phenomenon in the, well, internet's undefeated, but like this is, if it was different, I would tell you. I mean, the published results are there. 5 out of 1,000 people had fungi, and that's just not a thing.
Okay, that's good to know because a lot of people that is going around. I get it that it's a lot of
Oh
people
my
think
gosh,
that
it's
no
common.
implants have
Every
mold.
day I get asked about it. It's
Mhm.
ridiculous.
Yeah, well, this is all so helpful. One other thing before we wrap up, I wanted to touch on because I think it's really awesome is your non-surgical facelift because I heard you say that and I was like, wow, this is another, you have so many advancements that I love to learn about, but this is another thing if people could actually do things like that without having the surgery is pretty
Yeah,
interesting.
it's a bias I have. I think there's too many weird looking people. So I have never
Yeah.
liked fillers.
Hmm.
Always like to tighten skin before we would fill anybody. And I was never interested in use of a lot of fillers. I find it just to look odd.
Hmm.
Um, Basically, our sharp process is used to help prepare anybody for any type of treatment that I'm doing. And so it's running the same program. So if someone wants a open facelift, I don't do those anymore. I
Hmm.
used to do them, and then as technology has gotten better, and I have gotten more resistant to creating facial scarring or just things that I don't like to look at. I try to do things in hide, any access points, anything that would look unnatural. So for a long period of time, we did radio frequency skin tightening. So you can tighten tissues externally or deeper using radio frequency. It's been around for a long period of time. We use a tool called FaceTight, and that allows you, think of like an electrified pair of forceps, and they're so small that one part of the forcep goes beneath the tissues or beneath the skin, and you can just simply run it, and the transference of the energy allows you to tighten the tissues. So that's a deeper tightening. And so we can do that on the cheeks, on the neck skin, and underneath where the double chin area is. So that was, I did that for a number of years. And then we would combine it with microneedling. Everybody's probably heard of microneedling. There's different types of microneedling. There can be microneedling like you get at a day spa where it feels like a tiny little bump or pinprick, and they kind of roll it over. And it's to create a tiny bit of trauma in the skin to start your healing response, and that'll help build more collagen, build more elastin. So as we get older, all of those substances, collagen and elastin, we didn't talk about collagen, but every day somebody's asking me, can I take collagen and get better skin? And it goes to what we talked about earlier about absorption. So I can't tell you how Dr. Meg's going to absorb collagen or I will absorb collagen. Nobody can. And that's why I don't sit and say, oh, take this much collagen every day, because I don't know how each person will respond. That's your bio individuality. So
Hmm.
we're trying to do things to build up more collagen. So if we do that deep tissue tightening, that will stimulate more collagen. And then on the superficial level, we could stimulate more collagen with that microneedling. The microneedling I started in 2017 and 18 with Morpheus 8 used to be what we would use in a standard way that also uses radio frequency. And so that was very, very good. And then the next step is really how do we get skin to be tightened? So we can take skin out, like in a facelift, and then we can tighten the skin and suture it shut. But the way I want to do it is take it out and not have a scar. And so we use a device called Elocore. It leverages technology, and it's not microneedling, it's called microcoring. So
Okay.
for everybody listening, it's called microcoring. It makes tiny little openings, just like if you went to the dermatologist and got a biopsy. And the opening, if it's smaller than a half millimeter, will heal and there'll be no scar. And so we
Wow.
combine that with our deeper tightening procedure. And I also have a neck lift that's minimally invasive. And then with or without exosomes, with or without stem cells, in combination with cleansing treatments and hyperbaric oxygen therapy is my version of a no-cut facelift because we don't use a scalpel.
Hmm.
It's done under local. And we feel that is the most natural way to tighten everything without leaving visible scarring that, although it's not the same and the gold standard will be an open facelift. So if you want that, I'm not the person to come see. If you want a natural appearance where your skin can be tightened and you can age more naturally, then this is more of what you're interested in.
Yeah. Well, I think our listeners are interested in more in more natural options because, I mean, yes, and it's hard because we're in a for some reason I like to look at before and after pictures of like houses, face changes apparently or whatever. So I on my Instagram always get these feeds of like all of these stars that are doing things, and it's just we're getting bombarded with things that aren't natural all the time, but like feeling this like we got to keep up with things, and having like options like this is amazing, and I'm so thankful for all the information you shared with us today. So can you tell everyone where they can find more about you?
Right. If someone wants to lower inflammation now and they have breast implants in place and they're not ready to have surgery, you can go to our website and we have several things that you can do right now. You could learn more by listening to or reading my book about the SHARP methodology to lower inflammation and prepare yourself that way. You can take an inflammation test. If you want to kind of get a baseline, there's a urine test we offer. It's very simple, be done at home. And then we have a free webinar to learn how to detoxify and not retoxify yourself using the SHARP method, as well as the supplements we discussed to help lower inflammation in our patients we know have more challenges with breast implants. And then if you're a practitioner or a practice or a surgeon and you want to learn about what we're doing to help patients, you can sign up for Dr. Rob's training to help you with that.
Thank you so much. Thanks for being here with us today, Rob.
Thank you, Meg.
Have a great day, everyone.